start this way. So, Bismillah, let's. So, our today's topic is health system research. So, what is a research? First, we have to learn that what is a research. So, the definition of research. So, how that is defined. So, a scientific and systematic research for information on particular subject or issue, also known as research. It is embedded in epistemological position and theoretical framework. It collects essential evidence with the help of different research methods. Health system research. What's health system research? It's a part of research. Health research results closely linked to health system. So initially it was known as health service research. It was a you know health service research. Now it is a health system research. So it is related to the research on health. So if you go to the history of health service research, so it was in 1967 when Division of Research in Epidemiology and Communication Science was established for research works under WHO. So first was 1967, they established a research division in World Health Organization. Then in 1972, RECS was restructured. Research in, was restructured into division of strengthening health services. It was SHS, RECS to SHS means strengthening health services research. So responsibilities were transferred to division of SHS means strengthening health services. Then in 1978, Global Advisory Committee on Medical Research and Subcommittee on Health Services such were found. What to have to achieve health for all by the year 2000 and implement the primary health care approach successfully till that. In 1980, WHO recognized and established health system research with following mandates. So they have given mandate to first promotion, coordination, and information exchange in the practice of HSR. Strengthening of national capabilities for HSR training and development. Support to substantive research in priority areas. Then in 2000, health policy and system research was launched to improve the performance of health system. First time in 2002, under the umbrella of health system research, there was initiated a new sub-area public health system research by the Public Health System Research Interest Group. It was PHSRIG. It is a public health system research interest group. The health system, so it is defined as all the organizations, people, and actions whose primary intent is to promote, restore, or maintain health. So it is a known as health system. The definition of health as HR, HSR is so it is a multidisciplinary field of scientific investigation that studies how social factors, financing system, organizational structures and processes, health technologies and personal behaviors affect access to health care, the quality and cost of health care, and ultimately our health and well-being. Its research domain are individuals, families, organizations, institutions, communities, and populations. Now, concern of HSR. So, prime concern of HSR is to provide information for decision making that can improve the functioning of the health system. Now, such design. Now, specification of methods and procedures for obtaining the information needed. A plan for a plan or organizing framework for conducting the study and collecting data. serves as the blueprint of the detailed procedures and rationales of a research project, an essential part of research methodology. So, what is the study all about? Why is the study being carried out? Where will the study be carried out? What tools and techniques of data collection will be used? How will the issue of validity and reliability be addressed? What type of data are required? How much time will the study require? What will be the sample design? What technique of data collection will be used? How will the data be analyzed and interpreted? So all fall under the design of a research or methodology. Importance of research design is it serves as a foundation to formulate and guide the research study, supports in better planning and execution of the research methodology, useful in the estimation of probable research errors and handling strategies, maintains necessary control over the contents of the study, make the study more systematic and determine the exploratory, descriptive, or casual or causal phases of the research, determine the information needed, specify the measurement and scaling procedures, construct and pretest appropriate forms of data collection, specify sampling process and sample size, develop a plan of data analysis and presentations, so to develop a monitoring and control mechanism to facilitate the overall research function. Types of research design. On the basis of the study technique undertaken, research design can primarily be categorized into two forms. First, exploratory research design. Second, conclusive research design. So further descriptive research design and causal research designs. So three research approaches. First is observational research. So what do? You gather data by observing people, actions and situations. It is the exploratory. Second, survey research, ask individuals about attitudes, performance or behaviors. It is a descriptive research. Experimental research, using groups of people to determine causes and effects relationships. It's a causal research. Types of research designs. First, exploratory research. So what they have to do? Gathers preliminary information to define the problem and suggest hypothesis. Literature, research, expert, interviews, focus groups. So descriptive research, describe things as the market potential of product, consumer demographic and attitude, secondary data analysis, surveys, observations, panel simulations, causal research, test hypothesis about cause and effect relationship means causes. So what should the research design process? First, define the research problem, estimate the value of the information to be provided by the research, select the data collection method, select the measurement technique, select the sample, select the analytical approach, evaluate the ethics of the research, specify the time and financial cost, prepare the research report. Further, the component of research proposal, problem definition, study approach and designs, population sampling strategies, source of data, instrumentation, mechanism for research administration, mechanism for data processing and analysis, confirmation of the expertise involved, time frame of the study, cost of the study.